Want to welcome you to the next episode of the Plugged In podcast. And today we have Dr. Peter Bonutti. Dr. Peter is the CEO of Realeve. He's a surgeon and also an inventor. It's great to have you on today's show.
Thank you. Thanks for having me. I appreciate it, Mark.
Yeah, really looking forward to this one. Obviously, there's been a lot of years where you've had the ability to really educate yourself, especially in the medical career. So we'll definitely be looking at that. I also note that you're a father of 6 as well. So you've been a busy boy.
Yes, sir. The kids have become a priority. I've gotten later in life, but yeah, we stay busy. We like to work.
Yeah, it's always good, I think, to be able to talk to somebody like yourself who's been there and done it and is innovating constantly. So I'm definitely going to pick into that a little bit, but I'd love to know, obviously, when you started out in your medical career, I think you were a teacher at the time. How did that shape you and the way that you see medicine and innovation today? Did it have much of a shaping?
Yes, I would say that during my education, I went to school when I was really young. Started college when I was 16, finished when I was 20. Kind of gave me a little bit different perspective. And then when I'm going on to residency, medical school and residencies, I really tried to look at medical care from the patient's perspective. In the past, so I've been in practice now nearly 40 years. And when I started in practice, everything was built up or designed around what physicians, hospital centers thought about, cared about to make the surgeon's life easier, the physician's life better. And results were oriented toward how hospital systems and how physicians interpreted patient data. And as I started in the career, one of the beauties of my residency and my training was that we spent all our time in clinics, seeing patients, listening to them, both before surgery and after surgery. I'm an orthopedic surgeon. So I got to listen and hear their perspectives. And to me, that was critical. It allowed me to look and say, I've got to look at medicines from the patient's eyes, not from the doctor's eyes, not from the surgeon's eyes. So I'll give you an example. I was taught to do knee replacements, and we were doing knee replacements. We'd make everything easier for the surgeon to do the procedure so they could do it more precisely, more accurately. But we never looked at it from the patient's perspective of postoperative pain, recovery. It used to take a year to recover from a knee replacement. Patients would be in the hospital for a week, and they would have these massive incisions, and they'd have permanent weakness. But the surgeon would go, hey, the x-ray's perfect. The patient looks great. And the patient would be going, this is agony. It's taking them a year to recover. And you take a patient that's 75 years old, you do a knee replacement, they're going to live till they're 80. You've taken 1 year out of their life, which is a massive investment in the patient. So I said, let's revisit and focus everything we do on how patients think about their care and how they recover. And that's how I started innovating in the medical process. And that's now been 38 years ago. I developed a business incubator, a medical incubator. We have over 500 patents and over 700 licenses to pretty much every major medical device company. And it allowed me or focused me to say, look, I'm taking care of people, and I really care what they think, and I have to consider their perspective maybe even more than what I think is an end result for a physician, a provider, for a hospital. So that's kind of what formulated, and that's kind of still how I think about medical care, because it has to be ultimately the consumer is the patient. And I want them to come out of this satisfied and feeling like they've got the best result. And that's how I think about medical innovation as well.
Yeah, I think that's really refreshing because I've had such, even me as one person, and there's billions of us on the planet that have our own experiences, where the experience in the medical industry has been everything from absolutely lackluster to absolutely second to none and everything in between. There's so many discrepancies.
Well, a lot of it's because how we measure our metrics are often related to what we decide as doctors or as hospitals or as healthcare providers. And so we create metrics that give us an understanding, but looking at it from our perspective. And our metrics have always been wrong. How the patient recovers, and that's the most important metric, and we're missing that. And so I've looked even clinical research. So I've written hundreds of papers with my colleagues, and our goal is to say, if we look at a result of a surgery or a procedure or how a medical pharmaceutical is managed for a patient, we need to look at what the patient thinks about it as opposed to our own interpretation of the end result. And research, publications, intellectual property, design development, it has to change its focus. And it has been. And it's over my 40 years in medicine, I would say that it's improved, but it's still not where we need to be. And I think innovation, research, publications need to be more patient-centric rather than physician or healthcare provider-centric. if that makes any sense.
It does. And I think that will give people a lot more peace and confidence in surgeons and physicians and in health institutions if people are looking through the lens of the patient rather than through a procedure or through lenses that are maybe more academic than they are human.
No, I agree. That's been so. I look at research papers and I'll see with patients. So we follow them up and they say, look at survivorship of this patient, meaning the knee replacement or hip replacement, or whatever. At 10 years, 98% of these patients are doing great. But they're looking at x-rays. They're looking at what a surgeon is looking at, their range of motion, or maybe can they go up and down a flight of stairs. They're not looking at this as a patient, say, can I squat? Can I kneel? Can I do the sports, the activities that I want to do? Or am I just going to sit in a chair, go up and down a flight of stairs, and I have a pretty looking x-ray and everything's perfect? Well, that's not how we measure or should measure, because people have variable expectations, variable demands. But clearly the most important thing, I believe, is that the patient has to come out satisfied, and every patient has somewhat different perspectives. And so it's important to understand their expectations and gear our technologies toward what patients want in the recovery and the function and or their rehab as well. Because if a recovery takes a year, that's a big issue. And the patients need to know that. And we need to find technologies that enhance that, the recovery, the pain, the function, from what a patient thinks it should be, not what a doctor thinks it should be.
Yeah. Now, you touched on the fact that you've got over 500 patents and 700 licensed products. What drives that curiosity, Peter, and what is it that keeps you inventing across multiple fields? It's not even just in one particular field.
What I always look at as I find and identify problems is I look at my medical care and how I take care of patients. And I never pat myself in the back and say, hey, you did a great surgery. This went well. The patient loves you. I always look at the problems and I sit there and I say, what didn't I do well? And from every day I come out of that procedure, out of that patient care network, and say, what have I done that I could do better? What did I do wrong? How do I constantly strive to improve? Too many people look and say, look, I did a great result. 99% of my patients are happy. I've got these great satisfaction ratings. That's okay, but you're never going to get better. You will never, that's bad English. You will not improve unless you really look where your problems are or where other problems are and how you enhance that by sitting over there. And that's out of, I wouldn't say criticism, but you look at your problems and try to evolve. And that's how I even started to look at this company called Relieve. I'm an orthopedic surgeon. I do primarily knee replacements. But one of the biggest problems we had is dealing with central nervous system disorders, patients' function, recovery, pain, how they manage it. And that's all driven by the central nervous system. And we have limited ways to treat the mind, the brain, pain, in large part because of something called the blood-brain barrier. And what that is a protective function in the brain that limits the size of molecules that can get into the brain. And that limits, for example, our ability to use pharmaceutical agents, biologics, stem cells. You can't get these across the blood-brain barrier. And I looked at this and said, hey, even though I'm an orthopedic surgeon, these huge challenges that exist in how we treat pain, how we treat recovery, how we treat patients long-term has a lot to do with the brain. And unless we can treat the central nervous system or the brain, we will be limited in whatever medical technologies we're pursuing. So that's the big unknown. The biggest single problem we have in medical care. And if we could sit there and improve memory, cognition, degenerative diseases, stroke, trauma, we can improve these so that patients age. We can treat anything else in the body, but we cannot treat central nervous system dysfunction in large part because we cannot get the pharmacologics across the blood-brain barrier. We cannot get nutritional substance, many of them across the blood-brain barrier. And so if we have a mechanism that actively can open and close the blood-brain barrier on demand to deliver pharmacologics, biologics, stem cells, to allow healing and neuro-restoration, that is the big untapped area in medicine. And I believe that's why I'm so involved in this company called Relieve and this technology, because I believe this is one, maybe the best gatekeeper to allow us to treat the central nervous system for all its myriad of problems that we see.
Obviously, no, it's good. You're very passionate, obviously, about this, which is what we want. If you're going to be working on our bodies, you better know your stuff and you better be going in there with a lot of enthusiasm. One thing that I wanted to mention, because it's been a hot topic for a long time, and obviously it's Alzheimer's, and it seems to be everywhere, right? So looking at things like Alzheimer's, migraines, robotics, other illnesses, what technologies do you believe will have the greatest impact on our human health going forward?
I think robotics are a big area. I've been very interested in robotics for about 30 years because how we can use these to improve the efficiencies, the surgical approaches, the techniques, we manage them, and being able to do this not just on a macro level, but a micro level. So robotics, I think, are very, very important. I would argue, though, that the biggest single challenge we have in medical care really is, can we somehow treat problems in and around the brain? Because that is ultimately where we can't tap into damaged tissue. When a brain cell is injured or dead, how can you bring this back? Everywhere else in the body, we're able, maybe the best analogy I can use is a heart attack. You get a heart attack, your heart dies, your heart is permanently weaker. Now we're able to look at biologics, technologies that allow us to restore some of that cardiac function. And we can do that because the peripheral body, we can access it and we can deliver these technologies and they can get to the local or specific sites where we want to treat. Problem with the central nervous system is it impacts everything we do every day, all the time, from your beating of your heart to breathing to cognition and thinking about how we see the world, as well as function, recovery, strength, all these things that are important. Unless the central nervous system is functioning properly and unless we have technologies that allow us to treat this, we're going to be limited in our ability to care for patients. So to me, the ways that we can start to access and or treat central nervous system disorders, and then these will trickle down, I think are the most important. And many of these are more at a membrane or cellular level, as opposed to treating these in a macro level with major surgeries, major procedures. So if we can find ways to work with the body, using the body's own functional activities, but to optimize those when you need them and close them down when you don't. So it's, in other words, enhancing body's own approach to treating itself, we can sit there and optimize care. So I would look at it as saying the greatest space, I think, in medicine that we need to look at is how to enhance your own biologic function without damaging it or injuring it in the process, if that makes any sense.
Yeah, it does. And I'm fascinated now because obviously you've got these 500 patents and 700 licensed products. What do you believe has been your greatest innovation and your gift to the medical field?
I would say probably two most important. One are so we did a bunch of minimally invasive approaches 40 years ago, where we looked at anchors and reconstructive repair so that rather than trying to drill holes through bone or through tissue and pass curved needles through them, we were able to do anchors and fastener type technologies that allow us to do linear apposition. I probably have 70, 80 patents on different types of ways to fix tissue, repair tissue to tissue, tissue to bone in a minimally invasive approach. So we can do these with many of them with endoscopic or arthroscopic procedures. Second is robotic field. I'm very interested in robotics and joint replacements and have a whole series of technologies there that have been licensed on use of robotics and or navigation to enhance surgical procedures for joint replacement. So those are probably two of the ones that are closest to me. The most important one to me now going forward is this technology about enhancing access to the central nervous system. So big picture, those are probably things I'm most proud of.
And as both a surgeon and a father of six, how do you see health technology really empowering everyday people? Because some people are just afraid of things they don't know.
I would agree. Part of that, I think, is better access to diagnostics. And diagnostics would mean, for example, people at home that use now these portable EKGs that you can put on your wrists or your fingers, or certain wearables that allow people to understand their physiologic function better so that they get direct feedback and easier access to diagnostic procedures. Because once you understand the problem and accessing the challenge, it allows you to go forward with a frame of mind. I know what's wrong. I can now move forward and I can treat these problems. And patients, if they see what the pathology is or where their problem is, and they can see this through either wearables or easier access to diagnostics, they'll seek care earlier and they'll have better results because the medical care they'll receive will be earlier phase. One of the main problems we have in medicine is that many patients come to us too late and we have to do end stage treatments, like a joint replacement is an example. Do we need to really wait till the disease is that advanced that we only have an option of replacing things with metal and plastic? Or can we go earlier stage and treat these with biologics, allowing the body to heal itself, getting new cartilage, bone, etc. to grow. But the problem is we see patients so late on the spectrum, unfortunately, because they ignore things, they ignore the disease, the pain, and they keep trying to work through it, that sometimes we see them too late to do true restorative procedures, and it forces them to treat the patient more aggressively. So full circle, your question is what I see the best for patients is getting the ability to diagnose and treat themselves earlier, or diagnose them earlier so they can start their treatment process and healing at an earlier phase of the disease or the pathology, so it doesn't progress to what I would argue maybe is more of an end stage procedure. Does that help?
Now, you and your company, Relieve, obviously solve a lot of different problems. And I would love to know, what problem do you love to solve the most?
The most for me is in aging and the technology relating to dementia, because it is such a challenge for individuals, for families, and for society. It's probably the single greatest cost. We have people that start to lose their mental function, their memory. They fall into organic brain syndrome, dementia type pathologies where they are essentially cannot care for themselves and others have to care, so they become a drain to themselves, the family, and society at massive costs. If there is a way that we can develop neurorestoration function and or treating these diseases, I think would be the single most important change we can make in medicine. Because first, they have the biggest impact on society and individuals, but second is taking people that are non-productive and making them productive, make them able to function again, to be able to additive to society, to the workforce, to themselves, their families. Those to me are critical. So if we have mechanisms that allow us to assess these challenges earlier and find earlier ways to treat them, and look at what I would call neuro-restoration, which is not just trying to do, let's say, what Neuralink does, which you're trying to put, with robots, put brain implants in someone. Why can't we sit there and look and say, how can we heal that tissue and allow it to restore to normal neurologic function? Why can't we get these brains to live longer and better, as an example, and function better? And that goes to the core issue of access to the central nervous system for diagnostics, but more importantly for treatment. Those to me are very, very critical issues. And that's what Relieve is hopefully going to do, which is allow, for example, in Alzheimer's, you said you brought that up as it's a major, major medical issue. A lot of this is buildup of proteins that sit and essentially attach to the cells in the brain and slow down neurologic function. But part of that is because these proteins are too big, they can't drain out of the central nervous system because of this blood-brain barrier. So if we have a mechanism to sit there and flush these large molecules, these toxins that accumulate in the brain over time, and then secondarily deliver pharmaceuticals, biologics to allow these to heal on demand so that you don't have the side effects of opening and closing the blood-brain barrier, we would have a whole new mechanism to treat these type of problems, which I think are the greatest issues we have in society right now.
And what's your thoughts on Elon Musk with Neuralink? Do you feel like his approach is dangerous? And if so, do you offer an alternative path to the one that he's?
The general concept that they're looking at is we have damaged tissue in the brain, and we're going to use with electrical mechanisms in terms of implants, delivering these implants and allowing them to stimulate various diseased parts of the brain to function. So you have essentially external devices trying to supplement damaged tissue. Our philosophy and what we believe is long-term is to try to figure out not to bring an external device in to treat damaged tissue, but to treat the damaged tissue to get it to heal, to restore, to go back to what it could be. For many years, people have thought once a nerve cell is dead, it can never come back. But there is potential for neurorestoration, for tissue healing, for central nervous system tissue to heal, if the right nutrients, the right cells, the right pharmaceuticals can get access to the brain. I would not say his concept is dangerous. He's trying to treat a really serious issue for people that are significantly disabled. But I believe that there's maybe a better process in terms of trying to get that tissue to heal and restore, as opposed to try and bring an implant to replace the damaged tissue, is maybe the simplest way to describe it.
Yeah, makes sense. We've only got a moment left, but I always like to give you a little space just in case we haven't captured something that you really want to communicate, Peter. Is there anything that you kind of want to leave us with?
No, I think I talked too much. So maybe the best thing is to say, I appreciate people's interest. I think human health, the human body is really important. And I think if we get better care of ourselves and understand how to take better care of ourselves, I think everyone benefits. So big picture is, I think people are very interested in their healthcare. I think as we improve our technologies, so patients are more aware of their body, their function, and how they can optimize that, I think everyone benefits, and it comes full circle. My philosophy: patients come first, and our job is to help them achieve their goals, not necessarily what our goals are as healthcare providers.
Thank you, Dr. Peters. It's been really good. Yeah, looking forward to keeping an eye on you and Relieve going from strength to strength.
Thank you very much. Thanks for your time.
Thank you.